we are demonstrating is how Mobile Connect along with eIDAS allows very sensitive data like healthcare data. We are demonstrating brainwave scan data can be passed remotely to remote healthcare providers like a remote psychiatrist with strong authentication and providing state-provided hard identity. So the situation here is a French citizen moves to Sweden temporarily or permanently, maybe having a vacation in Sweden, and has some issues and needs healthcare access. So needs access to a psychiatrist remotely. So the psychiatrist here is logged in and is remote. The psychiatrist says that the psychiatrist needs access to brain scan data. And then brain scan data being sensitive data, the system needs to identify the patient using state-backed hard identity. And then the citizen being French citizen has got a hard identity, a hard digital identity provided by the French government. So the user clicks on the authenticate with EID, and the user is in Sweden now. So Clayster, which is the service provider providing this remote healthcare service, asked the Swedish government, can you please help getting the hard identity from a French citizen? The Swedish government presents a page where they say that we can help you. But first, user or patient, tell me where you are from, which European citizenship you have. So the user says, I am French. So the user selects a French citizenship here and then says, yeah, fine, let's go ahead. Now the Swedish government has handed over the request to the French government. So this is provided by the French government. The French government says that I have got a request from the Swedish government to provide the hard identity as regulated by eIDAS. So eIDAS mandates the use of these 4 pieces of data: first name, last name, date of birth, and a unique identifier. And this is a pre-consent. So French government is asking the French citizen, are you okay to give this data? I say yes. Now the service, Clayster service, is asking for some additional piece of data. First name at birth, place of birth, gender, and this is not mandatory as per the regulation. So as a user, I have a choice of giving it or not giving it. So I say place of birth is fine, not the rest, and I give consent. Now the French government is giving me option as a user that I need to be authenticated strongly and the data needs to be captured from any of these IDPs. Mobile Connect is one of them. So I say, I want to use Mobile Connect MO. Now Mobile Connect prompts me to enter the phone number. So I enter my Orange phone number and say, let's proceed from there. I get the SIM applet prompt in my phone for that number. I enter the PIN. So it's 2-factor authentication as needed by the eIDAS, which is substantial authentication. I am now successfully authenticated. It goes back to Mobile Connect. Mobile Connect MOA now provides the 4 pieces of data and the optional piece of data that was requested by the system back to the French government. So this is provided by the French government. So the French government is telling me, I have now got your data from your selected IDP, which is Mobile Connect MOA. So the unique identifier, date of birth, last name, first name, and the place of birth. Are you okay to submit it to the Swedish government? I say, great. Provide it back. So the Swedish government got that data. The Swedish government then handed it over to the service provider Clayster, and the system has successfully identified this patient using a state-backed hard identity. Still, the doctor doesn't have got access to the brainwave data. The reason is the system has identified the patient, but the user or the patient has not been authorized the system to allow the data from the brain scan to be available to the doctor. So the patient has got a notification here to provide an authorization for that sensitive data, which is brain scan data, to be passed to the doctor. And as soon as I provide that authorization, the brain scan data is visible to the doctor. And this is real-time brain scan data, and it's not any fake. Con, if you blink a bit faster, so now that brain scan data is being provided to the doctor, And even if I log off from the system, the data is still getting streamed because the authorization is provided. After the diagnosis is over, Kong surely doesn't want this data to be available to the doctor. Doctor may sell this data to the insurance provider, and insurance will go high. So what now this user wants to do is remove the authorization. So I delete the authorization as a user, and then the access to that data is gone. So it's completely under the control of the user when to provide that data, who to provide that data, and when to remove the authorization of data to whoever needs to see that data.